Hi class, Dr. Linder. We're going to take a look at the palate, which is the roof of the mouth. And the hard palate is the anterior portion of the roof of the mouth. The hard palate is primarily composed of bone and some mucous membrane. And it's really designed to provide this rigid support for dentition during chewing. Now, there's a condition called cleft palate, which is the non-union of the maxillary bones. And this occurs in about 1 in 1,500 babies of mothers who were not smokers, and 1 in 700 babies in mothers who did smoke. The therapy for this is typically surgery to help fuse that. Now, I want to explain one of the reasons for cleft palate, for conditions like this that become real problematic for babies. Now, this happens typically because there's an issue with folic acid, which is B9 or even B12. But if you think of if a mother is planning a pregnancy, typically the doctors will put her on folic acid because they know that folic acid is involved in closing things, closing the digestive tract, closing the neural system to avoid spina bifidas or meningomyloceles, where neural tissue grows outside of the back. These things happen. So they noticed a slight decrease if women were taking folic acid. When women are on the oral contraceptive, it actually depletes the body of B6, pyridoxine, B9, folate, and B12, cobalamin. And this creates a multitude of problems. It can actually create infertility as one possibility. It can create depression. It can create weight loss issues. And that's because folic acid, B9, and B12 are critical for a process called methylation. Methylation is the ability of the body to shift methyl groups, which is a carbon and 3 hydrogens, to be able to manipulate these around. It's called methylation. Methylation needs to occur for DNA synthesis, RNA synthesis, to myelinate the neural system, to produce neurotransmitters, to help with body composition and weight loss. And women who were taking folic acid were still developing, were giving birth to children with cleft palates. So they were like, how could this happen? When we're taking folic acid. Well, let me show you what happens. So if we look on the right-hand side, this is a pretty good place for us to start. There's something called homocysteine. And if you remember back to cardiology, homocysteine is like liquid sandpaper that can do lots of damage to blood vessels, causing strokes and heart attacks. So the body wants to find a way to get rid of that. Doesn't want it to accumulate, it wants to break it down. So in the presence of B6, pyridoxal 5-phosphate, the body can convert that to cystathione, which eventually breaks it down into cysteine. Spelled that wrong. Cysteine. Let's see if I can get it right here. Cysteine. Okay. So from homocysteine, you can get cysteine, and cysteine is a main ingredient to making glutathione, which is the most powerful antioxidant to humans. So from something kind of not so good, homocysteine, we can get cysteine, which is one of the 3 ingredients to make glutathione. You need cysteine, glutamine, and glycine. And cysteine is typically supplemented by using something called NAC, N-acetylcysteine. N-acetylcysteine. So it's got antioxidant capabilities. Okay, so that's one way of getting rid of homocysteine. Here's another way. Homocysteine bumps into something called methylcobalamin. Now, cobalamin is B12. When homocysteine and methylcobalamin bump in, this methyl group is donated due to methylation. It's donated to homocysteine, and homocysteine becomes methionine. Now, methionine goes through some metabolism, becomes S-adenosyl methionine to S-adenosyl homocysteine, back to homocysteine. And what can happen to homocysteine? One of two things. It can go to cystathionine with B6, this is B6, which can get converted to cysteine, which can become glutathione, powerful antioxidant, or in the presence of methylcobalamin, methylated form of B12, the methyl group could be donated to homocysteine, and homocysteine becomes methionine. In order to do that, you need this enzyme, methionine synthase. Okay, fantastic. Now, once that methyl group is donated to homocysteine, look what we're left with. On the top here at 12 o'clock in the center, we're left with cobalamin. But in order for this thing to continue to happen, cobalamin needs to be remethylated. It needs to get a methyl group to donate the homocysteine so that cycle can happen. Where does it regain that methyl group? Well, it gets it from, let's look at this. From our diet, we get tetrahydrofolate, which gets converted to 5,10-methylene tetrahydrofolate. And in the presence of this extremely important enzyme, MTHFR, methylene tetrahydrofolate reductase, MTHFR, methylene tetrahydrofolate, it converts this 5,10 into 5-methyl THF. This is extremely important because now that we have this methylated form of B9, this methylated form of folic acid, this methyl group can be donated to cobalamin, and then cobalamin becomes methylcobalamin again. But now 5-methyl THF lost its methyl group and becomes good old simple tetrahydrofolate. And this goes through this cycle, going up again over and over and over. But there is a large percentage of the population that lack this enzyme. These are the women that were taking folic acid, but genetically had this mutation in which they didn't have MTHFR to convert folic acid into the methylated form. If you don't have the methylated form, so many things go wrong. Okay, so hopefully that explains a little bit. And this could be 60% of the population have this. And these women, these people that take folic acid when they should, can actually develop cancers. So if you're not sure, you should get yourself tested. The two tests are called the C677T, or it's also called the A1298C. These are the two tests that can either be homozygous or heterozygous when testing for MTHFR mutations. Simple solution: if people do have this and it's serious enough, they take the methylated form. They should not be taking folic acid. That means they need to look at foods that are fortified with folic acid, and these things are very, very harmful to people like that. People that have migraines, that have heart disease, that have infertility, weight loss issues, anxiety, panic attacks, depression, one of the things to look for is this MTHFR, okay? And this also helps to, if the mom takes the methylated form, it can help prevent this. In terms of cancers of the palate, cancer is an accelerated growth of abnormal epithelial tissue that lines the palate. The symptoms are a painless ulcer. They get this pigmented patch. Again, you're going to see smoking with all of these: smoking, chewing tobacco, poorly fitted dentures, hot temperature, hot foods. These are things that can cause over and over again that type of insult, cancer of the palate. And typically it's radiation or chemotherapy or surgery for that. In terms of the soft palate, that's more of the posterior portion of the roof of the mouth, and it's composed of smooth muscle that is involved in helping to facilitate swallowing. And in the back of that soft palate, we have the uvula, and that's that flap that looks like a little boxing bag right in the back of the throat. It's composed of mucous membrane, connective tissue. It is controlled by cranial nerves 9 and 10. 9 is the sensory and 10 is the motor, in terms of saying, let's say someone touches the back of the uvula, that stimulates the gag reflex. 9 deals with the sensory, and 10 helps to lift up the soft palate symmetrically. It's the motor part. 9 is sensory, 10 is the motor. So it's involved in the gag reflex. Diseases of the uvula, typically strokes, because that can affect the ability to swallow and to eat. So the uvula is right here. This is the soft palate, and this is the hard palate. And again, here's the uvula. It's deviating to the normal side. And you could see here, if we look at the arch here, this raised, this one stayed down. So there is going to be a lower motor neuron lesion on the patient's left side. Something happened and the neurons, the motor neurons going from here, didn't activate to raise this up. If it did, the uvula would be right in the center. Okay, but instead it moved to the activated and to the strong side, moved away from the damaged side. So that's a good indicator of a stroke. And in this case, the damage would be in the medulla, because that's where cranial nerves 8, 9, 10, 11, and 12 originate from. Okay, when we come back, we'll talk about the tongue a little bit.